I'm Roy Blunt. I was a senator from Missouri for 12 years and a member of the House for 14 before that. Well, the first time I met Senator Stabenow was in 1985. We had both been selected to be one of the 10 outstanding young Americans by the JCs. And so they were having an event in Tulsa, Oklahoma. It's the first year that women had been included. And of course, if you're going to include women for the first time, Debbie Stabenow has to be one of them. And then I really didn't see her again until 1996 when we'd both been elected to the Congress. We were in the freshman class. We were standing on the steps of the Capitol, and she was in front of me in that class picture and turned around and said, "Don't I know you?" And I said, "You absolutely do, and we're going to do some work together." A lot of what happened in the Senate started with our mutual commitment to federally qualified health centers and the way those are set up and the way the payment structure is set up. That's something that had to be extended every 3 to 5 years, and we do that together every time. And in 2013, Senator Stabenow and I decided, why couldn't we use this structure, this payment structure, to do more for mental health? And what we didn't know at the time, or at least what I didn't know at the time, was 2013 was actually the 50th anniversary of the last bill President Kennedy signed into law. And that last bill President Kennedy signed into law was the Community Mental Health Act in October of 1963. And we went to the floor together, a Republican and a Democrat, the two of us on the floor going through that 1963 Community Health Act, which was designed to do really two things. One was to close most of the asylum-like institutions in the country that weren't serving anybody very well, and two was to replace them with high-quality, certified community behavioral health centers. And that was the bill we took to the floor, hoping that we could do that for all 50 states. As the 1963 legislation had anticipated, and that's what our bill did. But at the end of that process, we were able to get the ability to move forward with 10 pilot states to see what would happen if you did what the country had said it wanted to do 50 years earlier. And what we thought would happen, and what I think our original 10 states proved does happen, is you actually save money in the overall immediate context of health care when you treat mental health like all other health. But remember, this isn't just for Medicaid, it's based on the federally qualified health center model, so anybody can go. If you're government program, you can go. If you've got insurance, you can go to these centers. If you don't have either of those things, you can go and on a very accommodating sliding scale be seen. And more importantly, I think in every state that's gone down this pathway, you can be seen if you need to be seen that day. And we moved from 15 states to 25 states to then 35 states. So 2023, 2024 are big years in trying to finally realize a pathway forward that's been a 60-year goal now for the country. Well, I think one of the reasons that she was such an effective partner is one of the reasons she's such a good legislator. It doesn't have to be exactly the way she wants it to be to get something done. You know, just the democracy doesn't work like that. The legislative process doesn't work like that. And I've said a number of times over the last several years, one of the things that makes her a great partner legislatively is she is just relentless. And for legislators, relentless is a really good quality. Just constantly looking for, if we can't get it done this way, is there some other way we can get it done? But she is just effective. She knows what she wants to get done, but she also has a good sense of what's possible to get done. And you know, the best bill possible is usually not the best possible bill, but the best bill possible is what you have to keep focused on. Well, I think her legacy is pretty broad-based. I think that this is what we did together in mental health was an important part of that legacy. The things we did in health generally, like federally qualified health centers, are part of that legacy. But her incredible work in agriculture, her incredible work in food policy, in energy, in understanding that in the middle of the country where we both live, that our states both do better if you encourage a society that builds things and grows things. And Debbie Stabenow is all about building things and growing things.